further ado, I would love us to hear a few words from Mr. Ian Stein. He is the PAHO WHO representative to Jamaica, Bermuda, and the Cayman Islands. Ian, over to you.
Thank you very much, Shanique, and good afternoon to you and our esteemed colleagues that have joined us today, and to the range of people who are joining us online. First and foremost, allow me to take a moment to thank Dr. Daniel Boos from PAHO, Mrs. Atkinson from the National Council on Drug Abuse, and Ms. Nicole Dawkins-Wright from the Ministry of Health and Wellness here in Jamaica. I'm excited by the prospect of this conversation, and I'm excited every World Health Day to try to underscore the key points that are facing us and concerning us at the same time. As we look at today's theme for World Health Day, Our Planet Health, I want to take a moment to really concentrate and focus the challenges that are particularly disproportionate and high on small island developing states, including the Caribbean. Of course, we recognize that SIDS, small island developing states, have modest sized economies. And as a result, that might result in greater impacts from the challenge of climate change, and that these changes they're notable hurdles to us overcoming the challenges of climate change. While we frequently note in the Caribbean that the subregion is, of course, higher risk to more severe and adverse storms, weather events, et cetera, and of course, these should not be underplayed, the weather patterns are one piece of the high impact events that we're talking about, because it's not only about hurricanes and flooding, but we also are talking about the fact that these storms and the other effects affect whole countries when they take effect in small island developing states. In addition, we must be mindful that sea level rise as well will have a significant effect on economies, livelihoods, including, of course, the effect on tourism, marine fisheries, and of course, the valuable biodiversity that we have around us here in the Caribbean. So regrettably, the reality is that the small island developing states have a lower adaptive capacity arising from factors that are outside of our own control. And some may say that these disproportionate risks might actually be some type of climate injustice. So we're here now, but we also see that there's work underway. The countries in the Caribbean, while they're in a vulnerable situation, we're also working to evaluate the risks, adapt and strengthen the health systems to cope with climate change as well. And I think it's important to recognize that the work that is ongoing is not just a recent phenomena, but there has been important work that's been going on for many years. In 2018, countries in the Caribbean jointly elaborated and committed to implement the Caribbean Action Plan with the goal of protecting health and population against the effects of climate change. So just one concluding comment, because I don't want to take away from the comments from our colleagues that are with us today. We all recognize that tackling the causes of climate change bring enormous challenges, but they bring enormous benefits to a range of things, including our health. While the circumstances that we are facing appear overwhelming, while the challenges seem daunting, and while the hurdles seem high, if we take measures and if we take action and if we work collectively and take individual responsibility, there is reason for great optimism. So in this respect, allow me to pass back over to Shanique, and again, thank the colleagues that are with us for this conversation. I'm looking very much forward to hearing and participating in this conversation. Thanks so much.
Thank you very much, Mr. Stein. You've started us off with a call to action, and I am sure that our panelists are ready to answer that call. So we're going to introduce them without further ado, since we've had the context for this event that we're having. We understand the why, and these panelists will talk to us more about the issues that we would have highlighted just now. Our three experts are Dr. Daniel Boos. He is the advisor on climate change and health at the PAHO headquarters in Washington, D.C. We have Mrs. Uki Atkinson, research analyst at the National Council on Drug Abuse in Jamaica.
Good afternoon. Thank you for having me.
And we have Dr. Nicole Dawkins-Wright, who is the Director for Emergency, Disaster Management, and Special Services at the Ministry of Health and Wellness in Jamaica.
Happy Wellness Day, everyone. Good day.
We have a real panel of experts for this conversation. We want the conversation to be very open, one where you can ask questions, comment, and we'll be happy to answer. We are streaming on YouTube and on our PAHO Caribbean Facebook page. However, if you have any questions, please share them whether on Twitter, because we'll be monitoring those channels also. We really do look forward to this discussion because we have a lot to talk about. Climate change is an important topic. And as Mr. Stein said, it's something that we need to link to health because it does affect us in several ways. And to kick things off, we'll be hearing from Dr. Booth because he needs to provide us with a bit more context about the impact of climate change on not just the environment, but my physical, behavioral, and socio-psychological health. Daniel, I would love to understand a bit more of that.
Thank you, Shanique, for such a nice introduction. Now, let me start thanking Dr. Ian Stein for having me here today, our colleagues in the panel and colleagues in PAHO, WHO, and everyone that is watching us today. Thank you for the question. I mean, where should I begin, right? Because the impacts of climate change on human health, we have already acknowledged and feel those impacts. So climate change is not a future threat. It's a current threat that is going on and affecting the health of people everywhere in the Americas and the world. Some of the direct effects of climate change are, fueling hurricanes and increasing the intensity and frequency of hurricanes. For example, in the Caribbean, this is something that people grasp and understand very clearly and feel those effects. But also the heat waves and heat stress is intensifying in the region of the Americas. Wildfires are being fueled by prolonged droughts and higher temperatures, causing multi-billion-dollar damages and affecting people all over the region. And also climate change has an indirect effect. For example, in small island developing states, sea level rise, you can feel that, you can see that year by year slowly, but surely the sea levels are rising, and that is posing threats to multi-million-dollar resorts, touristic resorts in the Caribbean, to critical infrastructure like ports, airports, roads. And that's something that all of that has effects on health, because it has effects on how we live, how we play, how we enjoy life, and how we understand and connect with each other, with the nature, and with the environmental resources. But perhaps one of the things that I would like to highlight here is that we often think of the climate change effects as an environmental effect only, but rest assured that we do have many social determinants also affected by climate change, because climate change exacerbates the health impacts, exploring deficiencies in our infrastructure, in the way that we live, in the way that we produce, in the way that we consume, and explore the populations who are vulnerable, who live in conditions of vulnerability, are the ones that feel the stronger effects of climate change. So people living in poverty, in condition of vulnerability, lacking water and sanitation, exposed to poor air quality. So all of those problems, they have a connection with climate change, because climate change will exacerbate the effects, the human health effects to those populations. And we need to take them by the hand and help to reduce vulnerabilities everywhere, to improve infrastructure. And all of that will increase resilience to climate change. And of course, I cannot leave aside the importance of strengthening health systems. So making sure that we do have good surveillance systems, we do have proper staff with proper information, within the health systems to be able to strengthen health critical infrastructure to be able to respond quickly to challenges posed by climate change. So climate change is posing us a existential threats, not just the direct and indirect impacts that we are facing today. So we need to tackle this in a very serious way, and I hope that we can do that together, because that's the only way of doing that, is working together in collaboration at all levels and all sectors.
It's interesting that you spoke about the fact that what's happening in the environment impacts the health of us as people, because normally when we think of climate change, we think about the rising sea levels, the temperature change, but we never really think about, okay, because we're going to have increased heat waves, it means that I'll be ill or I may faint when I am walking outside. And normally when we hear it, we think about, all right, it's happening in Australia because they may have had the hottest day, but we don't think about it as something in the Caribbean or in our side of the woods, because we think it's a them thing, it's not a us thing. So it's very interesting that you kind of pulled that together and spoke about climate change broadly, and then, you know, a bit about what it means for us in terms of health. I'm curious though, so we understand that climate change impacts health broadly, right? But how does that fit into the Sustainable Development Goals, which are being pushed by the UN as a whole body, which we are part of?
Thank you, Shanique. No, and that's a really important question, because climate change poses a threat to the implementation of the Sustainable Development Goals. And like I said, and thinking on the opposite direction, also the lack of progress to many of the SDGs, the Sustainable Development Goals, puts us in a vulnerable position for the effects of climate change. So you can think of this as a two-way road, because things are interconnected. So if we don't achieve SDG 6, for example, on water, sanitation, and hygiene, the persons affected by poor water quality and diseases, those diseases are going to be exacerbated by climate change. If we don't, for example, related with lack of sanitation, dengue fevers, for example, which in the Caribbean is growing. The concern is growing the number of cases because of lack of sanitation included, and because of the favorable conditions for the mosquitoes to grow, to thrive, longer hot periods, and the mosquito is more active and bite people more often, and that's the life cycles of the mosquitoes are shorter and shorter, as well as the viruses. So everything is interconnected. We have to understand that if we want to tackle the problems in a systemic and systematic way. So the same thing with air quality. So same thing with SDG 7 and SDG 9 and SDG 11, which are all linked with air quality, for example, or SDG 12, which is chemical hazards. So we need to tackle those infrastructural problems if we want to be stronger to face climate change, because climate change will exacerbate the pressures that the deficiencies of these sectors have, will be explored and exacerbated by the health effects of climate change. So without tackling those problems and strengthening health systems, there's no way that we can succeed in tackling climate change. So we cannot detach things one from another. And that's perhaps the key message, that we need to work in collaboration between all sectors to be able to tackle the deficiencies that we see in our systems, because that's exactly where climate change will exacerbate those conditions, especially for the most vulnerable populations. So that's why we do have this mandate, this call that Dr. Ian Stein was urging us to think about, because we cannot detach things. We need to work in collaboration, and we need to tackle these things in a systemic and systematic way.
The point you made about collaboration and looking at or even the strategies that we employ in relation to climate change is quite interesting, because you're saying it's not just what's happening on your side or what you can control. We need to work together to achieve these objectives, not just for the SDGs, but for the continuation of our race and for us as a human race. So when you spoke about dengue and its impact on the Caribbean, it made me consider Dr. Nicole Dawkins Wright, because I know that her focus doing some work in Jamaica specifically, and also her understanding of what's happening in small island developing states, it really made me question about, what sort of impact climate change specifically had on small island developing states. Now, we normally hear about Vanuatu and how they're being impacted by the rising sea levels. We know about other countries in the Pacific, but when we think about us in the Caribbean, again, we kind of always want to say, oh, it's a bit of them, but never a bit of us. So Dr. Dawkins Wright, I'd love to hear about why small island developing states are vulnerable to climate change, and specifically us in the Caribbean.
Thank you, Shanique. Again, let me first, of course, just say Happy World Health Day to everyone. So we appreciate that what we're talking about, as Mr. Stein and Dr. Bruce have said, health is the issue in the context of climate change. And I think the first place to start in answering that question, Shanique, is what we already know, just to emphasize and repeat that the science on climate change is very, very clear, and is showing that even if we take significant action to achieve net zero emissions within 30 years, the planet will inevitably warm within the next decade and a half and remain so for at least another 50 years, up to 2070. Unfortunately, Shanique, that is a best case scenario, even under low emissions. And the evidence is in fact mounting that island states are particularly at risk to these challenges. We face unique challenges in addressing the impacts, and the relationship is pretty peculiar when it comes to SIDS, small island states, and climate change being extremely complex when we look in terms of the patterns that are formed through hazards, exposure, and vulnerability, the impacts and risks, awareness, and knowledge levels within the small island states, or capacity for adaptation planning alluded to earlier, and even mitigation actions. And what has been the strongest argument within the small island states is the argument surrounding loss and damage. So Shanique, the world is already experiencing more intense and frequent extreme weather events. And this is showing even more so in small island states. For example, within the Caribbean, if you just look within the last 2 years, we have seen record-breaking hurricane seasons. In 2020, there were 20 named tropical storms, 13 hurricanes, 6 of which were major. And last year in 2021, we had 21 named, including 7 hurricanes, 4 of which became major. The risks of the direct effects of extreme events are even more pronounced in small island states. High temperatures, changes in rainfall patterns that increase substantially, especially because communities, generally speaking in our states, are for the most part unable to protect themselves because of the level of poverty, especially with the low-lying countries. And it's not only that. When we think about the oceanic effects, many of our states have communities. We have to deal with the impact of rising sea levels as it relates to a protracted impact that will go on much longer because of the nature and the behavior of our oceans being much closer to our society, where the response on the ocean is going to be more delayed. Our freshwater sources, which is where we get most of our freshwater in our coastal aquifers, are being affected in terms of intrusion. We are seeing decreasing in our water quality from salinization. And of course, there's the issue of the increased threat of extended droughts and water security challenges that we'll have to contend with. And not only that, Jenny, even more so, when we think about it, the same factors that contribute to climate change that Bruce has already elaborated on it also concomitantly contribute to the deterioration in the air that we breathe. And it is concentrated in small island states. We already know that exposure to air pollution is not only responsible for the respiratory diseases like COPD and lung cancer and pneumonia. We know that the toxic particles reach into our system and cause major health challenges. We have issues with our non-communicable diseases or ischemic heart disease and stroke, even in disorders of our reproductive systems. All of these conditions are primary public health issues at this time, and climate change is set to worsen that. We already have enough evidence to show that even in the workload in our emergency rooms, the number of hospital admissions and all-cause mortality is already going up and correlated with the highs in temperatures that we're seeing. In Jamaica, when we had the dengue outbreak in 2019, that was the worst on record. And we have already seen this in the other territories within the Caribbean, and it's likely to happen for other small island states. And if that is not enough, when we consider our economies and our sustainable development potential, our vulnerabilities are a function of those issues, those social and economic characteristics, and our capacity to adapt is so much smaller that SIDS will inevitably experience far larger economic impacts than the global average. So many SIDS like Jamaica, which have large ocean territories, marine resources, biodiversity, which are critical to our economy, are similarly highly exposed to climate change. And we suffer at these consequences because of the association. Our sectors, these sectors that depend on the oceans and on our seas, contribute significantly to our GDP, fisheries, tourism, agriculture, being highly reliant on a conducive environmental conditions, which are becoming less and less predictable with climate change. We already know that small island states tend to have a higher occurrence of disasters, and single disasters, when they do happen, have widespread and long-term effects, eroding any adaptive capacity that we may have. Our economic stability is overturned, making it that much harder for us to even allocate resources to sustainable development.
Thank you very much for that thorough response. Based on what you've said, it really anchors the discussion. And the discussion that we're having, if you're just joining us, is about the impact of climate change on health. We're in the Caribbean, yes, but climate change and its impact on health is an issue that we all have to face together. It isn't a problem that's happening in another part of the world, it's happening here. Based on what Dr. Dawkins Wright just shared, we would all recall the 2019 dengue outbreak in Jamaica and in other parts of the Caribbean, which was a real issue. It meant a lot of people were not able to go to work. We were not able to do things that we would normally do because quite a large portion of the workforce was not able to go in office as normal. And even as we heard earlier, Dr. Booth shared that with climate change, it's meant that life cycles of mosquitoes and even those borne diseases it's very different than it was before. However, I'd love to change gears a little bit, because while we speak about climate change broadly, and we can talk about its impact with the vector-borne diseases and with mosquitoes and so on, the link needs to be made with tobacco pollution and also its environment impact. So we do have Mrs. Atkinson with us today. Thank you very much for joining us. And as a tobacco control expert, I am very interested in learning what impact does tobacco have on environmental pollution?
Thank you very much, Shanique, and it is a pleasure for me to be here. Thank you for inviting me to speak among this esteemed panel. Regarding tobacco's impact in terms of environmental pollution, while most of us are aware of the significant impact of tobacco on mortality and morbidity, we may know that more than 8 million people die each year because of direct tobacco use or secondhand exposure. So while that is so, and that's well understood, there is a growing recognition among the scientific community as well as policymakers regarding the broader context in terms of tobacco's some substantial harmful impact on development, and more specifically on the environment. So the bottom line is that the tobacco industry damages the environment in a variety of ways throughout what is called the life cycle of tobacco. Now, many people would probably not have heard about that before. It basically is speaking about from cultivation to consumer waste. So there are various steps. Tobacco farming, for instance, is uniquely destructive and aggressive for the environment because it is estimated to cause up to 5% of global deforestation. Tobacco farming is also associated with soil erosion, with reduced soil fertility and productivity, and disruption of water cycles. There is a use of harmful pesticides in tobacco cultivation, many of which are so harmful that they are harmful to both the environment and farmers' health, that they're banned in some countries. The manufacture of tobacco products and their delivery to retailers also have environmental consequences, including deforestation, which was said before, the use of fossil fuels and emissions of greenhouse gases and other waste. So toxic residue is another issue from tobacco smoke that lingers in the environment. So tobacco smoke leaves a long-lasting residue that gathers both on surfaces, it can build over years and become more toxic as it ages. In relation to post-consumer waste, cigarette butts and toxic third-hand smoke materials, those pollute the environment. Discarding cigarette butts into the environment remains one of the most socially acceptable forms of littering. We do not see people who smoke a cigarette and then find a garbage bin to throw away the cigarette. They just simply flick it wherever they are and throw it on the ground. The majority of nearly 6 million cigarettes that are smoked each year are littered, and the filter on cigarettes is comprised of plastic ingredients, which are particularly harmful to beaches and oceans. So among the substances found in the butts, these include arsenic, lead, nicotine, all of which they leach into the aquatic environments. According to a 2015 International Coastal Cleanup report, cigarette butts are the most common single debris item that is collected, representing 15% of the total pieces of debris collected worldwide. So this is really detrimental to marine and freshwater fish. So there you have it. The impact is way beyond the individual who uses tobacco or even the person who gets it on a second-hand basis, to the alarming facts about land, air, and sea pollution. Thank you.
I can absolutely see why you're so passionate about tobacco control, because while we talk about climate change in general, it sounds like, okay, we need to do more, but honestly, tobacco is something that we see people doing in our daily lives. We really don't check to say, have you thrown the butt of that cigarette in the bin, or, pick that up. It's more likely for you to say it with somebody throwing away another piece of litter versus a cigarette. And we are contributing to more pollution in our environment. And that's why it's so important for governments to really stand up against tobacco, because arsenic, these things, lead leaching into our environment, it's something that we can definitely control. So with that said, Dr. Booth, I really have to turn to you, because it sounds like several things are happening in relation to climate change and health. And as the person from the PAHO headquarters, you now need to tell us, how is PAHO as an organization helping to, supporting countries to mitigate the impact of climate change across the region? And this is such a broad question, because each country in the Caribbean has a different ask. So I can't imagine your job trying to deal with all these constituents and provide that support. Please talk to us a bit about that.
Thank you so much, Shanique. And let me just recover something that Dr. Atkinson's mentioned, because to me, when you think about tobacco, you think about, the person smoking and secondhand smoking, maybe. But, from the farm to the production, everything, all the chain of production is affecting climate change as well, and is affecting health in a way. So that's the type of approach that we are looking for when we are saying that we need a systemic and systematic approach to solve the problems, because we cannot detach one thing from another. So yes, we need to focus on the individuals who are smoking and control that, but there's the whole chain of production that is also going to be, health can be benefited from action also because of that. All the co-benefits that can be achieved by health with tackling the whole chain of production. And that's one of the, I already started with that because that's one of the things that we are doing as PAHO. Ian, please go ahead.
Thank you. I was just signaling to Shanique that I wouldn't mind just commenting on this, but thank you for the opportunity, Daniel. It's this is a tremendous conversation that I'm excited that we brought this group together. And it actually illustrates to me this old phrase that we used to talk about many years ago, and I haven't heard it recently, is the web of life, right? We talk about all this interconnectedness. And so when I hear Dr. Dawkins Wright talk about the impact on NCDs, and I hear Ms. Atkinson talk about this other issue of the pollution from cigarette butts, and we tie this all together, we see that we recognize the complexity of this. And while this could be overwhelming, I often refer to the way to eat an elephant is one bite at a time. And so while it's overwhelming and it's daunting, as I mentioned before, I'm actually excited at the prospect of taking this one step forward. And so as we're talking today about our planet, our health, and I'm really also excited to link this as an example to the conversations that are taking place here in Jamaica in the select committee that's actually talking about the limits on tobacco control. And it's just amazing to hear that as we're talking about the environmental issues, that we're also talking about these health issues at the same time. So I'm very excited by this kind of nimble conversation that brings it all together, that also proves that we need to be humble about the challenges as well. I know that many of us, when we talk about these issues, and especially when we hear the latest reports that are coming out from some very impressive research, it can be a little bit challenging to not become depressed about these things, quite frankly. And I think that when I hear these conversations and the exciting work that is moving forward, it gives us a new spirit to advance on the connections and the work to be done to address climate change and how it affects not only, but of course, very importantly, the environment, but also the important pieces on human health. So I'm very uplifted by this kind of conversation.
Thank you, Dr. Stein. No, and it's very inspiring to hear you as well. And taking what you brought as food for thoughts here. So you mentioned the Caribbean Action Plan on Health and Climate Change. And we tried to, that was a joint effort between Ministers of Health, Ministers of Environment, Ministers of Planning, Financing, to be able to extract opinions from all over the place to come to a consensus on what a climate change action plan should look like. Recognizing the complexity and the interconnectedness between these topics and sectors. So to answer Shanique's question, I'll quickly go through some ideas that came across my mind when she asked that question on how to implement and how to protect health from the effects of climate change, but now taking these kind of a broader approach. So one of them is making sure that health, all the governance structures, the institutional structures include health. So really putting the health in all policies approach into place, but also all policies in health. So that we need to take all these sectors and incorporate those into health actions and the other way around. So health needs to be seated at the highest level in interministerial committees on climate change to be able to be heard and to be able to influence policies, interventions, norms and legislation, taking the health lenses, even in areas outside of the scope of health mandates. So I can give some examples on promoting active transportation, healthier lifestyles with healthy foods and nutrition, buying local foods, organic or producing with less chemicals, food and water, by having green spaces, promoting green spaces and the use of urban green spaces for mental health aspects, for socialization, for stimulating physical activities. So we do have policies that will lie outside of the health sector that will have a tremendous impact on health. And we need to learn those and work in collaboration with all the sectors. And also we need to do our part on planning. And I'm very happy to announce, and perhaps Dr. Nicole Dawkins-Wright can also comment on that, but very recently, using part of our project on EU CARIFORUM, Jamaica received funds to start preparing their vulnerability and adaptation assessments on health to climate change and the Health National Adaptation Plan. So those would be the roadmaps created by the Ministry of Health, but with other sectors, on how to advance with implementation of a climate change and health agenda in Jamaica. And among the actions that should appear there or already appear based on what Dr. Dawkins-Wright mentioned is the strengthening of surveillance systems, integrating surveillance systems, making sure that we can build national observatories on climate and health to be able to, most of all, anticipate events, to prevent effects on health. So we should not just be responding to things after they happen. We need to be able to stop things before they happen. And that's the best way to protect human health. So being able to be smart in those decisions. And since I mentioned smart, just to mention the health infrastructure, so the Smart Hospitals Initiative, that's a tremendous opportunity that we do have, that we need to make sure that, infrastructure is smart, is safe, and is green. So does not contribute to human health, right? So that to impact human health. So we know that all doctors, I'm a biologist myself, but all doctors, when they have the oath of medicine, they say, first, do no harm. And that's something that health cannot continue to promote contamination, pollution, and impact to human health. So we need also to stop subsidizing fossil fuels that are harmful for health. So we need to think of this thing in a systemic way. We cannot address things from the health perspective or within the health sector alone, because all the actions that happen had impacts on health. And that's one of the key messages that, to call for action in an integrated and concerted way between all sectors is the only way to move forward.
Shanika, you know that I like to stir the pot sometimes, as we say. If I may, I'd like to ask a question to our colleagues, and I know that that's your role, so Shanika, so I'm asking your indulgence on this in this respect. So I'd like to ask that the issues arising for climate change and the pieces that need to move forward are we all countries together need to take some collective action. And what I'm wondering about is that the most recent example that we have when all countries around the world have had to take collective action on these things, COVID-19, has not necessarily resulted in the most promising view towards the future when we need to take hard, difficult collective actions. So mindful of the challenges that we had in the face of the pandemic, Ms. Atkinson, Dr. Dawkins-Wright, and Daniel Poos, what makes you hopeful that we can get this done so let me leave it for you there with the mindful of our experience.
I don't know if you want to call on anyone in particular, but I think, Mr. Stein, I choose to remain hopeful, and I want to congratulate the team, certainly from the country office, but I want to look straight to our chair, our youth, Shanique. That's why I'm hopeful. She is here as a young person, pulling us together on one platform on World Health Day to talk about this. The youth is our future, and if she is interested enough and can carry this conversation like this, there are many others like her, and I will partner with her and others like her to make sure that the collective action that is required will in fact happen, even if we take our one step at a time. Because in Jamaica, we say, every mickle make a muckle. You take your one step, trust me, if we pull together, it is likely to be a significant advancement that allows for me to be optimistic and take that so that we can take action going forward.
And does anyone else want to comment?
Yeah, just say I support that view 100%, and so I will not add to it because I think Dr. Dawkins Wright said it very well.
Dr. Booth?
No, I fully agree. I cannot agree more. But the challenge is not for the future. The challenge is for now. So we need the youth, but we do need us as well, not that so young anymore, to be able to work and tackle that together. So it's an intergenerational problem that we have. I have a 4-year-old daughter, and I think about that. What's the type of world that she's inheriting from me, and that's the type of thing that move us together to work across generations with the same goal.
It's interesting that you said that, because in the high-level event this morning, Dr. Etienne, who is the PAHO WHO director, she said that we have a unique responsibility. One, we are custodians of our environment, and two, we're architects of the future. And I thought that was just absolutely profound, because it's easy for us to blame things on people before us, or say, I can only do so much and no more because, the future is the future. Let another generation worry about it. But us in the present, we are on the cusp of both. And so we have this huge responsibility that we must take seriously. And we know what's happening. So that's why we can have this sort of conversation. So I thought that was very, very fascinating. Thank you for that question, Mr. Stein. It was just extremely timely. Since we've been speaking about our own responsibility as people and also as a collective, it's really the perfect time for Dr. Dawkins to speak more about what the government of Jamaica has been doing in responding to climate change, specifically in relation to our health systems.
Thank you again, Shanique. I think Mr. Stein and Dr. Bose and Mr. Atkinson has really quite said it and illustrated what it is that needs to happen and what it is that we're doing locally, because it does in fact require collective action. And so strengthening the resilience of health system in Jamaica is occurring within the national context of building resilience with respect to climate change, using a multi-pronged approach, a whole of government approach, and interestingly enough, for Jamaica, a hybrid approach to the climate action that singles out 6 priority sectors, one of which is health. Now, with health as a priority sector, we have been very involved. It has been mentioned before in terms of the Caribbean Action Plan on health and climate change, and Jamaica participated significantly in that because we tend to use it as a platform moving forward, and we believe it is a very robust framework within which to build the resilience of health system. And a good first consideration really is the overall burden of disease that we are contending with as a country. So it is not surprising that one of the thematic areas upon which we build our action to build resiliency is really just to reduce the overall burden of disease, generally speaking. So let's take, for example, air pollution that we would have mentioned. Nationally, the best way to reduce air pollution will be to stop burning fossil fuels. So changing policy around the source of energy that we're using is in fact, one of the most effective ways that we can realize impact. And in Jamaica, we are starting along that lines with legislation for enforcing the air quality guidelines that the WHO has put out for us as guide, that we are domesticated in terms of our operations. And as recently as within this year, in 2022, we have brought to the general public an updated emissions policy to be applied in Jamaica, whereupon actions will be taken that goes across the board and involves several different entities, organizations, ministries, departments, and agencies. This will allow for the strengthening of the governance framework, certainly at local level, and more importantly, as Dr. Buss was saying, allow for more immediate positive outcomes that can be realized once there are enabling measures that will look in terms of, for example, transport, particularly the public transport system, so that we can promote more sustainable ways of public transport, maybe even reducing the use of private cars, more efficient energy use of our buildings, including urban design concepts that will realize a reduction in traffic congestion in certain areas. At the sector level in health, we have taken steps, again, with the support of PAHO, our great partners, in terms of the WHO project to update our climate change country profile that looks in terms of the progress that we have been making with a view to taking more fervent action. And we are guided by our Vision for Health 10-year strategic plan that was published just last year. Appreciation, of course, that most of what we need to do require partnerships. And we have already alluded to, for example, the PAHO Assisted Smart Healthcare Facilities Project, of which Jamaica is one of 7 beneficiary countries. And we have realized a design and a methodology whereupon we can build the resilience in our country. And we are hoping to move forward as that project ends, transcend into another more scaled up implementation of the concept brought about by that project. That Vision for Health strategic plan look at a whole comprehensive and holistic approach, acknowledging the need, of course, to increase the resourcing of the health system. Again, the WHO target of 6% in terms of our GDP is what we're building on. And as Mr. Stein had pointed out, it would be remiss of us not to incorporate the lessons and experiences that we would have had through the COVID-19. The COVID-19 experience, what we have done here in Jamaica, has been a learning opportunity for us that allows us to move more confidently with the recently embarked health system strengthening project that we have launched just last year that reflects this improved approach to public health that takes into considerations all the many different aspects and interventions required to address the many determinants of health, one of which are the many prongs of the climate consideration. That program, that health system strengthening program, emphasizes resilience building, and we will be better able to efficiently respond to emergent challenges, not least of which are the variations occurring with our NCDs, our non-communicable diseases, as well as other climate-sensitive diseases. We will see organization and consolidation in terms of our integrated health services network, bringing all partners to the front and putting the individual at the forefront of most of our activities, improvement in management, quality, and efficiency, because we know everything has a limit. And there are 2 principal components in that program that will see the use of modern technology, certainly in terms of our information systems for health, that will have capabilities for remote provision, such as patient monitoring, e-prescription, electronic health records, all of which being designed to improve the benefits through collaboration and at the same time managing the control of costs. Specifically, we will see our infrastructural improvements, we will see quality of care improvement, we will see improvements in terms of our human resources for health, upskilling individuals, diversifying our human resource health services in terms of our manpower, and of course the modalities to improve access to care through telehealth provisions, mobile services, and of course, the GIS technology that we're incorporating. All of this spans, of course, not just the clinical aspect, but the business of healthcare. Healthcare as an industry is looming in Jamaica. Dr. Bose would have mentioned the whole issue of the supply chain considerations. And so, of course, we are looking to upgrade and modernize the business aspect of our health service and our healthcare delivery mechanism, partnering, of course, with our private sector to expand capacity that allows for the cross-transfer of technical skills, seeing investments in health promotion and prevention methodologies. Ms. Atkinson made reference to behavior modification measures that we intend to target, not just for the NCDs, but also we look in terms of our air quality considerations. So that's, I'll stop there, Shanique, just to say that it's an updated program that we're looking at and has a multi-pronged approach and taking into consideration what would have been shared earlier.
It's really great that you answered your question in that way, because while you were speaking, we got a question on Facebook that asked, how can other countries take action? And the person who asked the question was in Barbados. And while we do speak about the wins and the strategies that Jamaica may have been implementing, the real value is that we can replicate it in other countries for us all to win and achieve that collaboration that we need in order to tackle climate change and its impact on health. Because what I'm constantly hearing is that dealing with climate change and its impact on health is not a my business versus your business. It's all of us are in this together because we want to stay on the planet for quite a while. So while we've spoken in depth about climate change, health systems, we spoke earlier about how tobacco control and using that industry as an example of pollution that we can control, how that fits into climate change. I really want to return to that because I know that you'd have shared, Dr. Dawkins, right, broadly about what the government is doing, but I'm really keen to pick up that conversation about the concerns regarding youth. And so one, the concerns regarding youth and their engagement with tobacco, and two, how are we controlling its use, because the young people, as we know, are the biggest market for these tobacco companies. Mrs. Atkinson, I'd love for you to talk us through that.
Thank you very much, Shanique. So I'll start with the tobacco control measures that we have implemented nationally, and then I'll talk a little bit about the concerns about youth. So recognizing the burden of tobacco use and exposure on the use and exposure on morbidity and mortality and overall development. In 2005, Jamaica became the 73rd country of 182 countries worldwide that have ratified the World Health Organization's Framework Convention for Tobacco Control, the FCTC, which is the most widely adopted treaty, or one of, in the United Nations system. It is a legally binding treaty that requires countries to implement a range of evidence-based measures to reduce tobacco use and exposure to tobacco smoke. So the measures, range from protecting the population from tobacco smoke exposure in indoor public spaces, banning and restricting advertising, promotion, and sponsorship, a whole range of measures. In 2013, our tobacco control regulations came into effect. But at that time, we had only taken, as Mr. Stein said, a small bite. So at that time, the regulations covered only a few articles of the treaty, namely the articles that related to protection from exposure to tobacco smoke in public spaces, the regulation of product disclosures, so packaging and labeling and so on. More recently, as was alluded to earlier, a more comprehensive tobacco bill is currently being debated in Parliament. So this is really a timely conversation because this act now includes the expansion of the prohibitions to include the use of electronic nicotine delivery systems, that's otherwise known as ENDS or e-cigarettes. So the use of those in public spaces, the bill speaks to that. provisions to prevent sales to minors, it also speaks to that. Measures to address advertising, promotion, and sponsorship, support for reducing dependence, and a fixed penalty regime and graduated penalties. Now, the situation among youth is, you know, as with other countries across the Americas, Jamaica is very concerned about tobacco use among youth. Now, nicotine, let's just say very quickly, is a highly addictive chemical. It's the highly addictive chemical compound in the tobacco plant. In fact, it is one of the most addictive psychoactive substances. And the early the onset of use of tobacco, specifically habitual use, is the higher the likelihood of dependence and health-related problems later on. So nicotine exposure can also disrupt adolescent brain development, which, as we know, it continues. Brain development continues until the mid-20s. So successive global youth tobacco surveys that we have conducted at the council have revealed that approximately 16% of Jamaican adolescents are current users of tobacco products. When we did the GYTS, that's the Global Youth Tobacco Survey in 2017, 11% reported current use of cigarettes and e-cigarettes respectively. And what we know also is that the average age of onset of use is 12 years old in our context. And 80% of our youngsters who have reported current use have reported use before age 14. Like other countries in the Americas, we've also been seeing increasing popularity of e-cigarettes among adolescents in Jamaica. And this is of grave concern, especially because the risk perception of these products is very limited. Limited because the way that they're marketed as though they're healthier and safer alternatives to cigarettes, when the truth is, the nicotine content in some of these products is significantly higher than even in some cigarettes. And then there are dangerous chemicals contained in the liquids, and the long-term impact is not well known. So there is also the risk, vaping and nicotine dependence has created a major risk among our adolescent population. So beyond the risk perception issue, there's also access and availability to these products. Surveys have revealed that almost 60% of our adolescents who have reported current use of cigarettes, who bought them from a store or a vendor, purchased them with no challenge. So it tells us that there is greater need not only to have the regulations, but also to enforce them. That is required. Thank you.
Your response, Uki, was very interesting because it highlighted that, yes, we speak about the environmental determinants of health. The social ones also impact the environmental determinants of health. And in this instance, we can definitely see that tobacco is not just a risk for children getting access to it, but its disposal, the entire life cycle. We have a huge problem on our hands. And it is good that we are aware of this issue and actively taking steps to change it. I know earlier, Mr. Stein would have spoken about the tobacco control legislation that is underway with deliberations in Jamaica. And it's one step in the right direction, as Dr. Bush said. We are coming up onto the top of the hour, and this is the time where we really need to wind down, and I want to give each of you panelists an opportunity to give one takeaway. It may be a call to action or one point that you really need to underscore with our audience as they return from their lunch break and back to their desks for the rest of the afternoon. I'll start with you, Dr. Booth.
Thank you. Thank you so much, Shanique. I really enjoyed and learned a lot in this event. So thank you for having me here. So maybe, I don't know, the takeaway message would be that together we can move faster, go further, achieve more. And that would be my take home message and takeaway message to you as well, that don't let climate or eco-anxiety stop you. Let's face this together, because it's possible to do that. And this is, events like this and discussions like this prove that we can move in the right direction.
Definitely. Strong words. Don't let eco-anxiety get the best of you. We are turning next to you, Uki, for your final words.
Thank you. Very quickly, I will repeat the fact that all forms of tobacco are harmful, that there is no safe level of exposure to tobacco, and that it impacts our health, our development, and our environment. And everybody really, please do what you can to spread the word, and let's keep collaborating. Thank you.
Definitely. Sounds like a call to action to me. And over to you, Dr. Dawkins, right?
Thank you, Shanique. Just to say that now more than ever is when it becomes vital that we must increase and accelerate our efforts. And we in SIDS, for the sake of health, are strongly advocating for increased action from our developed countries to limit global warming. We're calling on researchers to provide more SIDS-specific research. And most importantly, for Caribbean, we cannot act alone. We require collaborative efforts, and everybody can and ought to play a part.
Important words. Ian, I am sure that you and I were co-hosting this session, and as is right, I wondered if you felt inspired by this conversation, because I sure did.
Thank you, Shanique. Absolutely, I am inspired. I think that what I'm impressed by is an overarching theme from all of our colleagues that joined us today, and for which I'm especially appreciative. This overarching theme is that each of us has a role to play. There's policymakers in government, there's persons in Washington, D.C. that provide technical support to the range of countries that allow us to understand what's happening in each of the countries. It's you and me that have to take some action, and it's anybody who's actually listening, because everybody has this space to be able to take a step forward. Whether it's a person who's not working in an NGO or is working in an NGO, the person on the street, they have a voice too. They can reach out to other persons to say, this is something that matters to me in where I live. And therefore, if it's important to me, it should be important to others as well. So I think that's an overarching theme from all of our colleagues. Thanks very much, Shanique.
Fantastic. Thank you very much, Mr. Stein. I wanted to just once more remind us of the ethical aspects for developing countries to halt GHG emissions. I know that Dr. Dawkins Wright and Dr. Buss wanted to touch on those, but it's really important because we need to ensure that we take those steps for each of us. It's not just impacting one side of the world, it really is a problem for each of us and for the generation to come. I have to say with a happy heart that we've had a discussion that I believe we can all be proud of listening and participating in. It's been a conversation that needs to be had, and we've had the right people to kind of lean into that dialogue. We've had someone from the headquarters who can provide that overarching perspective on climate change and its impact on health. We've had someone from one of our countries who is working to implement that directly. We've had a subject matter expert that can speak to one of the pollutants, which is tobacco. And we've also had Mr. Stein, who can provide that overarching view of which links what is being done nationally with what the organization PAHO wants to do in the region, and also with an understanding of what the WHO is doing internationally. I'm pleased with this discussion, and I hope that during this lunchtime session, you have enjoyed it as much as I have. Thank you very much for joining us. Again, I'm Shanique from the PAHO Communications team, and it's been my pleasure to be with you. Until next time, happy World Health Day.
The Food and Nutrition Project has gone all out to make a difference in the fight against trans fats.
So one of the things we're trying to do with this project is to educate the public on what trans fats are, and so that you can know what to look out for. One of the contributions